Okay, let me know when it's ready. And while we're waiting, thank you for the conference organizer and university for giving us the opportunity to present today. My name is Angela Lee. I'm a shareholder and managing director for Asia Pacific. Is the voice okay? Everything okay? I'm hearing.
Angela, your voice is
Yeah.
missing.
Is it okay?
Yes, yes, it's okay.
Okay, let me know if I have a little.
Okay, you can start now.
Thank you. So today, after Anna has shared about, I'm sorry, I'm really hearing some echo. Okay on your side.
Excuse me?
Is everything okay on your side? I'm hearing some echo on my side.
Yeah, it's
Hi.
you can start now, Angela.
Hi, Angela. I
Oh,
think it's a bit muffled. I can
is
hear like, yeah, it's a bit muffled. So
okay.
probably,
Um, I am on the Jabra. Is it okay?
yeah, I think probably you have to near the speaker. So
All
yeah,
right,
all
good.
right.
Thank you. Sorry about that. Okay, now we start. HKS, Anna just speak, and Anna has already touched on a little bit of sustainability for interior design. So right now, I want to start with a big picture first. What does it mean by sustainability, and what do we do with green hospital? So let's start with the world, because sustainability is about not just about my home, my country, it's about everybody. So um, in 2015, the General Assembly, actually from the UN, has adopted the 2030 Agenda for Sustainable Development that includes 7 Sustainable Development Goals. And on that same year, the Vice President of the Republic of Indonesia was also there and has signed on for this goal. So Indonesia is definitely one of the supporter for the 2030 agenda. Okay, for the 2030 agenda, it did talk about sustainability, but for the most part, there are 17 main goals. It starts from poverty, hunger, well-being, education, and gender equality. And as you see, there's 7 goals altogether. It goes way beyond what we used to think of sustainability for buildings, way beyond that. We think sustainability is really um, about, it's a blueprint for peace and prosperity for people and the planet, and now into the future. And in its heart, there are 17 sustainable development goals. We call it SDGs, which are an urgent call for action by all countries, developed countries and developing countries. And it's in a global partnership. And they all recognize that the ending poverty and other deprivations must go hand in hand with strategies that improve health and education, reduce inequality, and spur economic growth, all while tackling climate change and working to preserve our oceans and our forests and land. Now, with that big goal in mind, what can architect like us do? So at HKS, we have 300 lead professionals. I'm one of them. We are ranked as one of the top green firm, and also have already went through 154 million square foot of lead project. And right now, because we're representing a U.S. firm, we refer to lead project. But when we're working in Singapore, we might use not might we will follow the Singapore guideline, and also Hong Kong has different one. When we work in the Middle East, also have different guidelines. On top of LEAD, we're also a big supporter of well building guideline, and I will touch on that a little bit later towards the end of the presentation. Just remember this, if after the entire presentation, there's so much information that you can't remember all of them, LEAD is for building, well is for people. Okay. two different guidelines, and they should go hand in hand. Now, also our company and a lot of the big company will produce a report, yearly report of how they do. So we didn't do too bad as of right now. Actually, this is the latest number. That, as you can see, the total gross square footage reported that is designed as sustainable. For our company, we have reached over 72 million square feet. Okay, I'm not going to go through all the numbers and all of the graphs, but this is a standard report that we go through every year for the American Institute of Architects. Okay, so now at HKS, we wanted to design with a purpose to create a better world, which aligned with all of the goals that we just mentioned. But a little bit more about ourselves. Both Anna and I are principal and shareholder of the company. And one thing Anna is not only a good friend, but a mentor. And she was voted one of the top 25 most influential people in healthcare design. So we really are, even I'm with the same company, very honored to be presenting alongside of her. Okay. For Green Hospital, we talk about healing process and having a sustainable green hospital with fresh air while you're indoor. It definitely help a patient to heal. Now, most of us really might want to go outside and be outdoors, but when you cannot and you have to be in a protected environment, you still want to be as close to nature as possible. Okay. So, as the patient, if you were asked to visualize your ideal place for healing, what comes to mind? It's not going to be in a room without natural light. All fours, nobody wants to heal in the surgery room. They want to go back to the patient room where they can see outdoor. Okay. Now, but hospital has a lot of essential services. It has consumed a large amount of energy, and they're open 24 hours a day, not like office building. It's 24 hours a day, saving lives. So we treat them a little bit differently. And in addition, many energy intensive activities occur in hospital. Laundry, medical, lab equipment, a lot of energy. Sterilizations also create steam and heat. And then IT, computer, server use, food services, refrigeration, all of them. And again, surgery required certain humidity level, imaging equipment too. A lot of the very, very expensive equipment, some of them are up to 20 million US dollar a piece of equipment. When they are delivered into the hospital, it has to be already air conditioned with the right humidity. Otherwise, you're gonna lose millions and millions of dollars if you don't protect the imaging equipment correctly. So those are high energy consumption that we really cannot skip. It has to be done. So in a typical green hospital, these are the distribution of energy use and consumption. Okay, it varies country to country. Some will hit even within the United States. I'm in Texas, so we cool more than we heat. Okay, except for a couple of weeks ago, we were very, very cold. Okay, and then for sustainability in the healthcare sector, that timeless design was inherent in economical so that we are socially responsible. A lot of the projects we do, may it be with government or with private client, we has to be responsible to the budget, and for government project, of course, to the taxpayer. Okay, but based on calculation, and this is more on the client side and operator side, is that if we can cut energy costs, we actually will add revenue. Based on one study, and I think this is on the optimist side, really optimistic side, is when we cut $1 of energy costs, we can actually generate $20 per square foot in a new revenue. So if you think an average US hospital, which is around 200 to 300,000 square feet, spend $6 a square foot on energy, they're actually earning or saving more than 1 million a year in the long run. Now, we all know when we think green hospital, sun angle, responding to the solar exposure, natural breeze, daylight, these are really the basic. And then, of course, indoor lighting, what kind of light bulb lighting equipment that we're using for mechanical equipment, heat recovery chillers, energy recovery ventilators. A lot of this need to be considered. Photovoltaic solar panels are being used in a lot of hospital right now for the most part, non-essential services. Like it's okay to be used in maybe a conference room or classroom. Again, we won't use that and won't rely 100% on solar panel for surgery. That is very, very scary. Okay, we would not recommend that. All right, interior. I think Anna already touched on this, but it is a huge, huge factor. Okay, and a lot of the materials now for interior finishes, it used to be more expensive than non-sustainable materials, but more and more now it's almost about the same. So you're not spending more money by using the right materials. Okay. Now, I think the benefit for greener hospital is obvious, but a lot of time we haven't think about the other than patient, it's the workers and the staff. I mean, we can recruit better staff or staff will stay longer. The treatment outcomes is better, less risk, and then really better public perception. A lot of people think hospital is a scary place and they don't want to go, but sometimes we do want to encourage even with their healthy patient, they're not patient, they're healthy, coming in for checkup, and we want them to come to the clinic, come to the hospital without worrying about contacting diseases. Okay, so um, I can, our stance on sustainability is very, very strong. It has been for more than 10 years now. Okay, so I'm gonna share a few projects that we did that is geared towards green hospital. The first one is a design competition in Singapore. We call it the Cascade. It's actually a community hospital, so it's a step down hospital. It doesn't really read like a hospital because it's mostly patient room. It's situating right next to Tan Tock Seng Hospital, so the actual heavy duty um, treatment area is, excuse me. Okay, so these are some of the, I'm not going to go through every single item, but these are some of the um, methods that we apply to this hospital for green and sustainability certification. Okay, so the previous slide talked about exterior design, and this one is interior, water, collecting rainwater, roof garden, and how wind will flow through the building. Because in Singapore, as some of you will know, that there are certain classes of different patient rooms, and some actually have no air condition all the time because those are heavily subsidized room from the government. So when we design some of the public hospital, we have to consider natural air, placement of the hospital. So that was Changi Hospital. We're working on Changi Hospital renovation now. This is designed for national dental care. Now here's a planned example of how we study. I mean, a detailed study of where to place some of the balcony. And you can see on the lower left-hand corner, we actually computerize and look at the wind flow of where we put the different balconies to optimize the placement of them. You see the floor plan where we have the green area. We actually study very, very detailedly how to stagger those um, green roof and balcony. Okay, all study. Now this is diagram to indicate the study because sometimes We cannot show all our computerized calculation. But once we did, we will share this with the client, why we place things the way they are. So sustainability has to work with the function of the hospital too. Okay, so we can show them, now this is where the wind is coming from the north. So that's where we place the open area. But on the other hand, the hospital still function the way it needs to function. And you can see on the right-hand side, we actually study many different options of how the patient ward or patient unit should organize to maximize the effect. Here's another one that I just mentioned. So is it better for, in this case, because it depends on the site, they're all different. Should we stack all the public space and sky garden vertically, or do we stagger them? And we found out that if we staggered the sky garden, actually we have a better effect and better wind flow. Okay, this is more steady. And one of the very first LEED certified hospital is Presbyterian Hospital. It's not the biggest hospital we have done. It's only 96 beds, but it's very comprehensive, and it was done more than 10 years ago. It's one of the very, very first in the country, if not in the world. Okay, but it can still be very pleasant, right? All right, here's another one. 90 bed satellite hospital. In Florida. So different climate, different humidity, different orientation, different calculations. These are construction photos. Okay, of the same project in Florida, by the water. It's a beautiful site. Another one is in Ohio. Now this one, again, different climate, different orientation. Okay, 144 beds. It won a lot of design award. Okay, has view to nature, use of healthy materials, and even 17 better than ASHRAE 90.1 requirements. And it's LEED Silver Premium, less than 1% of the construction cost. It doesn't cost a whole lot more to have a sustainable hospital. All right, these are some of the hospital that we have that has received LEED certification that we have worked on as early as 2009. Okay. All right. So, and then I want to share some of the hospital that we are working on. It's not quite new anymore. Some are new, some are not. So here we go. Fort Hood in Texas, USA, LEED Gold. It's a government hospital, government military hospital that I worked on. Okay, a lot of clinics, some patient beds, and ancillary diagnostic and treatment area. ACHA Hospital in Ohio, again, LEED Silver. Capital Health, more than 1 million square feet of healthcare facility, hospital with clinics. Again, LEED Silver. For 1 million square feet, we save a lot of energy. Even in Kerala, India, something that we worked on about almost 9 years ago, we were able to achieve LEED Gold. It doesn't cost a whole lot more. Children's Hospital, CS Mont, and other big, huge hospital, LEED Gold. This one was a design competition for Cancer Center. It won the highest award of from the American Institute of Architects. I forgot how long ago I worked on, maybe 11 years ago. And it's also, see the little turbine, and it was also the early days of sustainable hospital design. Okay, Jordan, okay, is a cancer center. And then I just have a few more. This is the one I just mentioned. It won the first prize for National Design Competition. And then, sorry, this is a little bit fuzzy, but this one is in Washington, D.C. Not only is it LEED certified, but it's net zero, GSA net zero. This one we have already seen, Presbyterian Flower Mound in Texas, LEED Gold, our very first LEED certified hospital. Now, all right, sorry, I clicked too fast. Remember I said at the very beginning, sustainability, we talk about LEED, we talk about hospital and building. Now, keep that in mind, we have WELL. WELL is for people. Green sustainability is for building. And we don't separate them. We're going to combine them. What does it mean? Now, learn a little bit more about WELL certification if you haven't heard about it. We don't have a lot of time today to go through all of them. Okay. But we spend over 90% of our time indoors. So what does it mean? You know, I'm 50 years old. That means I have spent 45 years indoors as of right now. And that's how important it is for us to properly design our interiors and air quality. Okay. All right. Now think about this. For normal building, now let's not talk about hospital because it's so specialized, but just step back for a moment. We spend about 1 to 3%, the clients spend about 1 to 3% on energy. Real estate about 8 to 10%, but in the US, about 90% is spent on people. Hiring, salary, benefits, all of it. So another question to think about is, and to ask ourselves is, you know, what determines your state of health? Genetics, medical care, lifestyle, but a staggeringly large percentage of your health is dictated by your physical and social environment. Now, in our industry right now, there are three silos. Silos, that is a term that we use in the state, but it means they are not connecting with each other. We have health science, studying of the, the lab and health science, um, mm, doctors, nurses, right? And then we have building science for our architects here. And then we have business and economics, money coming in and out. But those three are not really connecting. If we can connect all three, and that's what it means by well building standard. The standard is trying to connect all three. All right. So why do we want our building to be well certified? We attract talents, we retain talents. Okay. We have fewer negatives and more positives. Fewer sick days, higher returns, okay. More productive business, and more productive people. In our office in Singapore, I actually have someone to come in and test our oxygen level and carbon dioxide level. And we were told that our oxygen level is higher than usual because every morning, even though we have the air condition on, we will open the door, open the windows upstairs and let fresh air in. And based on some of the engineers we work on, people will be more alert throughout the day when you have high oxygen level in the office. So currently for WELL certification, it has different criteria: multifamily, education, retail, and communities. We already have some health facility, but not as much as the commercial side. Okay. So we're working on focusing on healthcare, large public space, and sports, fitness, recreation area for WELL certification. The components of the WELL building standards are ascribed to body system, cardio, digestive, endocrine, immunity, and so on. Okay. And there are 7 concepts for WELL certification. WELL sets performance requirements in 7 concepts and is relevant to occupant health, your health, not the building health, your health and well-being in the built environment: air, water, nourishment, light, fitness, comfort, and mind. So just like LEED certification, we have to go through this checklist. And this is the balance of WELL features. If the building is going for WELL certification. Okay. And the comprehensive approach to healthy environment is what WELL is targeting with the guidance of the 7 concept. WELL Living Laboratory is located in Rochester. Yes, Rochester. And they actually have a lab with sensor and people working in that environment and that lab, and sometimes sleeping in that lab. They have mock bedroom to test and research on what is the optimum environment for people to live in or work in. Some of the WELL Living Lab environmental data that we collect: air, temperature, humidity, ventilation rate, filtration, acoustic, and so on. This is what they do in the lab. Okay. And what the WELL building standard is and is not. It's focused on the health of people, not the planet. And that's what I keep repeating myself and saying, well, it's for people, sustainability is for building. Okay. There we go. So I want to end this with this WELL's building standard. I know it might not be very familiar with everybody. We all know sustainability. We all understand what green building is. It could go from very, very detailed or just having a rooftop garden too. They're all green. They're all advantageous to you and the users. Today, I really want to take the advantage of your time and the privilege of your time to introduce WELL certification. And the presentation ends here. Thank you very much.